5 o'clock. We call the meeting to order, please, with a roll call.
Thank you, Mr. Chairman. Legislator Frost,
Here.
Legislator Calamus,
Here.
Legislator Mosier,
Here.
Legislator Leindecker,
Here.
Legislator Nortz,
Here.
Legislator Moorhan,
Here.
Legislator Leviker,
Here.
Legislator Osborne,
Here.
Legislator Nellenbach,
Here.
and Legislator Dahlhoff.
Here. Would everyone please stand for the invocation and the Pledge of Allegiance, and Legislator Kalmus will lead us in the invocation.
Heavenly Father, as we come before you today, we seek your wisdom and your strength as we serve our communities, guide our hearts and minds in our decision. Lord, as we approach this week, 4th of July, we ask for your blessing on the United States of America and all the women and men that serve us and continue to defend our freedom. We ask this in your name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So tonight we have 3 public hearings. First one is on a local law amending and replacing local law number 3-2015, a local law of the County of Lewis to provide a uniform system for managing the collection, transportation, and disposal of solid waste and recyclables. At the same time, we'll hold a public hearing for the demolition and removal of the structure located at 1057 Amon Road in West Leiden, New York. And lastly, an addition of 0.2 miles of trail and parking area to the Lewis County OHV trail system located in the town of Martinsburg. So is there anyone here that would like to make any comments on the first one, replacing law number 3-215 on managing solid waste? I don't see anybody jumping up and down, so we'll move to the next one, the demolition and removal of the structure located at 1057 Amon Road in West Leiden. Anyone have any comments on that? Joan?
This is a hearing on the unsafe structure by the Code Enforcement Department for the property at 1057 Ammon Road, which is at the corner of Route 26 in West Leiden, New York. All of the legislators have the exhibits and packages that my office provided, which contains the notice of condemnation, the enforcement officer's report and recommendation for demolition, a description of the condition of the property, which partially collapsed in the during the snow season. The resolution to set this hearing and the notice of the hearing, which was served upon the owner's relatives. The owner is deceased. If I can have Connor put up the pictures for the board. This is the property that's from a view from 26 prior to the winter when there was a partial collapse of the building. That's from one side of the building. And now we see this structure partially collapsed. And I think we have about 4 or 5 pictures of the building. And there you can see from 26, it's essentially collapsed into the right-of-way on Route 26, which is a very dangerous situation. So the recommendation from the code, and that's the notice of the condemnation to keep people out of the structure as required by our local law for the building to be posted. The recommendation from the board is to have it demolished, completely demolished and properly removed. I was able to have some conversation with the son of the owner. The owner is deceased since 2001. Her son has been paying the taxes on the property since that time. We looked into their history. The owner had a son, Stephen, and he lives in the Boonville area. I've been in communication with him. She also had a daughter who had predeceased her, but that daughter had 2 children. They have been contacted by Stephen Zelasco. All 3 of them have indicated through Stephen that they would like to transfer the property to the county in lieu of them having to go through the cost of the demolition. We do have in the packet the resolution for this board to basically confirm the decision of the code enforcement officer and direct and order the demolition within 30 days by the owners or relatives of the owners. We also have a late resolution for the board to authorize to accept transfer of the property from the heirs of Madeline Zelasco to transfer the property to the county, which will expedite the demolition and the process for us to recover the cost of the demolition. I'm just a little concerned that we actually get that deed transfer, so that's why Tim and I thought the best course of action for the board was to have the board pass both resolutions. I do have Code Enforcement Officer John Rose here if anybody has any other questions on it, but that is basically the information that we have on the property, and it is my recommendation that the board confer with the decision of codes and condemn the property, order its demolition within 30 days by the owner, and if possible, we will try to have them transfer their interest in the property to the county so we can have that demolition start sooner. Any other questions for me? And Mr. Chairman, I would just have a copy of the submissions that we presented to you become part of the record that the clerk of the board will maintain.
Thank you. Anyone else have any comments they would like to share on that building? We'll move to the addition of 0.2 miles of trail and parking area to the Lewis County OHV trail system located in the town of Martinsburg. Does anyone have anything they'd like to share on that? I don't see any interest right now, but we'll leave that open until 5:30-ish, and we will move to privilege of the floor. We have Mr. Kayer with us, who is our hospital CEO, and he'd like to make a few comments along with an introduction. So, Jerry?
All right, thank you. It's my great pleasure to introduce to you Colonel Christina Buckner. Colonel Buckner assumed command of the U.S. Army Medical Department activity at Fort Drum, New York on July 21st, 2023. Shortly thereafter, I had the opportunity to meet the Colonel for the first time as I sit as an ex officio board member on the Fort Drum Regional Health Planning Organization. And she has really been a positive addition to the health community that resulted ultimately in a visit by the Colonel and her command staff in April of this year. The Colonel was born and raised in Brooklyn, New York, and enlisted in the U.S. Army in 1995. She graduated from the University of Iowa in 2001 and earned her commission through the Reserve Officers Training Course, the ROTC, as an Army Medical Service Corps officer. The Colonel had an opportunity to engage with the Board of Managers last week, and we are here as a result of that visit in April. It was a very constructive visit, and we were able to demonstrate our willingness to serve both the soldiers and their dependents through the Lewis County Health System. So the Colonel is here to address and introduce herself to you. And Colonel, thank you for joining us tonight.
Legislators, team, good evening, and thank you so much for allowing me to be here and to address you this evening. What a great opportunity presented by Jerry, one, to come in and say on behalf of the Fort Drum Medical Department activity and the Fort Drum community, we thank you. As you all know, of all of the divisional posts that exist within the Army's inventory, we here on Fort Drum, with the most busiest division, doesn't have a hospital on post. It doesn't have a hospital on post by design, and that's because it is the nature of our intricate relationships with our community partners is why we have a hospital for Fort Drum. And we leverage our partners here in Lewis County. You know, one of two of the last standing county general hospitals that exist in the state of New York that provides us with quite a bit of care to our patient population, and most recently OB services. Some of you may know that we are going through a change in the military health system. The Defense Health Agency is relooking at how we deliver health care as a military health system enterprise, and really looking at ways to consolidate and ways to manage the limited resources that we do have within the Department of Defense. And most recently, just because of some staffing shortfalls, we have had to really look at our ability to provide sustainable and safe OB services for our community members on Fort Drum. And as of 1 May, we had to make a very sad decision to shut down our service line and divert to the community. But that action started more than 18 months ago. In August of 2023, we were faced with that challenge. By October of 2023, we came to our partner here, Jerry, to express those concerns that we just needed an encatchment as we were trying to provide some stability until a decision can be made. And of course, they have been a great partner. And with all of your support and the contributions that you've given to that hospital, they are now our encatchment for many things, but now also OB. So I just want to say thank you. We're going to work to maintain our connective tissue. The medical ecosystem is a very important one to all of us on Fort Drum. And through these partnerships, we're going to provide safe and quality care and great access to care to our service members. And I will just have to tell this quick story to the team in the room and to the people listening. So most recently, I got a phone call from a friend of mine in Texas. Now think about this, Texas. And he says, Chris, I need to get a cadet that's at West Point in New York into a sleep therapist so that they can commission on time. And I said, okay, why? I'm at Fort Drum. And he's like, but they can't get him in for like 8 weeks. And I said, hold that note. Let me make a phone call. And sure enough, my team calls back, oh, ma'am, Lewis County will see him in 2 weeks. We got him. And I said, hey, buddy in Texas, send the referral. We got him. And the kid commissioned. So, and that's because of our partnerships here, that they would send somebody from West Point to the Fort Drum area, to Lewis County General, to receive the care that they need to commission into the United States Army as of last month. So again, on behalf of the Fort Drum Medical Department activity and the Fort Drum community, we thank you for this partnership, an enduring partnership, and for all of the love and support that you give to one of your biggest proponents to the care for our service members. So thank you, and thank you for allowing me to address you this evening. Thank you.
Colonel, welcome to Lewis County, and thank you for sharing your expertise with us. Appreciate it. The June 3rd board meeting minutes have been distributed, and if there are no amendments, they stand approved. Report of the Finance and Rules Committee per Rule 6. Cassandra.
Thank you, Mr. Chairman. The Finance and Rules Committee has met, and they recommend to waive rules to act upon late resolutions.
Need a motion. Herb, do I have a second? Jessica, any discussion? All in favor? Anyone opposed? Carries. Clerk of the Board report, please.
Thank you, Mr. Chairman. Orleans County sent 3 adopted resolutions titled urging the state of New York to promptly transfer state-ready inmates from county jails to state correctional facilities and fully reimburse counties for related costs, calling on Governor Kathy Hochul to veto Senate Bill S. 8012 and Assembly Bill 8332 relating to the assessment of solar and wind energy systems, and opposition of U.S. Department of Labor closing Job Corp centers. This is just another reminder to the board to mark your calendars for September 8th through the 10th for the NISAC Centennial Fall Seminar in Niagara Falls. And if you're interested in attending, please reach out and let me know so I can make reservations for you. That concludes my report.
Thank you. Standing committee reports. We'll start with Finance and Rules with Legislator Osborne.
Thank you, Mr. Chairman. A reminder to the board that there is a scheduled walkthrough tour of the Wines Falls Elementary School building on Thursday, July 10th at 1 p.m., led by Dank. This will allow you to see the interior and exterior of the building and the work that has been completed. And I have a motion. I move to change the date of the July Legislative Committee meetings to Monday, July 14th instead of Tuesday, July 15th, due to that day being the Lewis County Fair opening and the fair parade. I make that a motion.
Moved by Tom. Do I have a second? Vince? Any discussion? All in favor?
Aye.
Anyone opposed? Carries.
And that's all I have, Mr. Chairman.
Any questions for Tom? If not, we'll move to General Services Committee with Legislator Moorhan.
Thank you, Mr. Chairman. Details for development of the Lewis County Winter Recreation Master Plan can be found on the county website under Recreation, Forestry, and Parks Department in the tab for Winter Recreation Master Plan. There is a community outreach survey regarding this that will close on July 21st, and hopefully everyone will participate. Improvements are underway for the Lee Golf Trail and Pioneer Cafe Trail. Updates with pictures will be posted on their social media page as soon as they are available. The Board of Elections held primary elections on June 24th and had a total turnout of 101 voters. And that's all I have. Thank you.
Questions for Andrea? Thank you, Andrea. And we'll move to Health and Human Services with Legislator Moser.
Thank you, Mr. Chairman. Office for the Aging's Farmers Market coupon distribution event starts this month. The dates and locations are posted on the county website and social media pages. They will also be hosting Health Aging Day at the fair on Thursday, July 17th from 9 a.m. to 3:30 p.m. with the championship round of the puzzle contest following the day's event. And that's all I have, Mr. Chairman.
Questions for Jessica? Thank you. Board representative on the Hospital Board of Managers, Legislator Nortz.
Thank you, Mr. Chairman. Excuse me. There was a loss of $332,000 versus a budgeted gain. I'm fogging up here. Excuse me a minute. Budgeted gain of $33,000 for the month. Year-to-date loss was $1.9 million versus a budgeted loss of $900,000. Acute admissions were at 75, 12 below budget. Observations were 93 or 28 above budget, the highest in 4 years. ER visits were 70 below budget. Outpatient visits were above budgets by 252 visits. Skilled nursing facility has the lowest occupancy of all time. Also, proposed threats to Medicaid cuts by the federal government were also discussed, which is something that should concern us all. And orthopedic expansion and podiatry is underway up to the hospital at this time. That's my report, Mr. Chairman.
Questions for Vinnie? Thank you. And we'll move to the county manager report with Mr. Hunt. Yes,
Oh, sorry. I'm sorry.
sure.
This is a breakdown on the impact of the Big Beautiful Bill Act. And as you might guess, I'm not looking at. So yesterday, you may have seen that both the Lewis County General Hospital and the residential healthcare facility were referenced in various periodicals. And when I arrived to work on Monday morning, our director of operations handed me this posting in X. And it was a back and forth between the governor and Representative Stefanik. And our picture of the health system was very pronounced in the piece. So there have been there are some matrix for both long-term care and acute care where there are judgments being made if organizations are at high risk for closure if the Big Beautiful Bill is implemented. So I communicated to the Board of Managers the following. For LCGH, the matrix used for the hospital includes the following. However, facility-specific data is not provided. I frankly am quite pleased with our financial performance over the last 8 years. And 6 out of 8 years, we've had a positive margin. And we've expanded, we've grown service lines, and we're able to form the relationships to make sure we have local access to healthcare. So these are the two. Hospitals that are in the top 10% of the Medicaid payer mix nationally, meaning we have a larger proportion of Medicaid patients to non-Medicaid patients. That is us. 30% of the people we serve are Medicaid recipients. The next 30% are Medicare recipients. So 60% of our total book of business are paid by the two levels of government. Now, Medicaid right now pays somewhere between 65 and 70% of the cost of care. Medicare pays 101% of the cost of care. And you deal with large budgets. That's just not a recipe for success. So that leaves the next 30% is the commercial insurance product, which is largely driven by employers. And we, as one of the largest employers, help support that. And then 10% represents charity care, bad debt, and self-pay. And generally speaking, self-pay becomes bad debt or charity care. So I appreciate the academic individual in North Carolina who says that's not a good recipe. But what they fail to mention is that we have really grown to maximize exception funding. So funding that is not connected to delivering a service. And their whole premise is that we are not generating enough revenue from operations to cover the expenses. That is correct. And in fact, we've had that conversation before. So in rural America, very few hospitals generate enough revenue from operations to sustain those operations. They do exactly what we do. And there are multiple sources of that funding. It could be a VAP grant. It could be the Medicaid supplemental payment, and other sources of revenue. An example of that source of revenue is something good that happened last week. We graduated 10 Lewis County residents from the BOCES LPN program. And that entire tuition for those 10 students was covered by the Caring Gene grant. And we have 2 more years of that grant. So it is incumbent upon current leadership and future leadership to pursue exception funding. And if the measure is going to be the delivery of healthcare services, sustaining the healthcare system, that is not the recipe for success. We have to pursue other sources. The other metric for the hospital is 3 straight years of negative operating margin. So that is correct. From an operating margin perspective, as I just explained, we have relied on this other funding. I don't see that as a negative. I see that as a reality of delivering services to a rural community and meeting the needs of our community members. For the nursing home, it's a little different matrix. There is a very large report, and line 370 in the report says this: the focus of the report is the proportion of residents with Medicaid as the primary payer. And the baseline is greater than 85%. More than 85% of the residents in the nursing home are on Medicaid. What does that speak to? It speaks to the level of poverty in Lewis County. The second benchmark is the occupancy rate is less than 80%. And for the RHCF, the occupancy rate is 75%. Since this has been generated, it is greater than 75% by a few percentage points. So we have lower occupancy. Remember, we have 160 beds, so 75%, and so we're less than 80. And so do I feel badly about it? I feel badly to the extent that there are people on our waiting list who want to get in who can't get in. So from that perspective, it's not good. But you got to remember, we live in a state that has mandated staffing levels for long-term care. So if we can't, if we have openings, so we admit residents to the level of staffing so that we meet the mandated staffing levels. I don't complain about that too much because there has to be a certain level of staffing to adequately care for the residents. So that makes sense. So we work hard in supporting things like the LPN graduation and CNA training programs. So the news may appear bad, but as I said to channel WWNY yesterday, for 90 plus years, our county has figured how to adjust to curveballs as they are thrown at us so we can still meet the needs of our community. Now, I didn't know any of those folks from 90 years ago, but we have a crew here with your support that we will be able to adjust to whatever comes from the big, beautiful Budget Act, and we will move forward. So that is my report for tonight. Do you have any questions of me? So if you are having trouble sleeping tonight and you want to review the impact of the Big Beautiful Act, this is most certainly going to help you sleep better. So have a good evening and thank you.
Thank you. Okay, let's go back to the public hearings. Is there anyone that would like to make any comments on the 3 public hearings that we're holding? Seeing no interest, I will now close the public hearings. And we'll move to the county manager report. Tim Hunt.
As I mentioned last month, I've been busy doing employee reviews with all the department heads, and So I really don't have a report, but I would like to just say thank you to our department heads. Lewis County is very fortunate in that we have a lot of talented people managing each individual department. And many of those are also going to be dealing with a lot of curves that are coming their way this budget season. So I'm very confident that we have the right staff in place to make those adjustments, and we'll be starting budget shortly. That's all I have.
Questions for Tim? County Treasurer Report, Mr. Verkor.
Thank you very much. I'm just going to correct Tim. We've already started budget and the department managers are diving in already. So I'm sure they're having fun. You've got my written report. I wanted to just provide some clarification, I think, on fund balance. I tried to make some changes, and adding the fund balance for the general fund was one of those changes. And I think want to clarify any confusion. And I would start with some terminology we use in accounting on point in time versus period of time. When you look at financial statements, a balance sheet is considered a point in time. The fund balance is part of the balance sheet. So at any day, or at month end or year end, we define a balance sheet at that point in time. The income statement in typical terms, or the revenues and expenses, is a period of time. So we look at the revenues and expenses for a month, or for 6 months, or for a year, a period of time. So that's a differentiation. And that kind of ties to, when you look at the fund balance, from my technical accounting perspective, it changes. So you might see 24.4 million I show as our general fund balance at the end of May. That's different from what I reported at the end of April. That's correct technically from an accounting perspective. I think from discussing with Tim, I think maybe confusion from legislators' perspective in what we budgeted or what we appropriated for revenues and expenses and fund balance. So we have not changed what you have budgeted for 2025 for our fund balance. So there's definitely a difference there between what our actual fund balance is and what's been appropriated or budgeted. So I think maybe just one other note to that is, if we do not often change that, we do not often in the middle of the year have to appropriate more fund balance. It happened last year with the IGT, or Medicaid supplemental payment, when we had a very high change in what we expected as an expense. So we had to appropriate additional fund balance. Again, we don't typically have to do that. And if we don't have to do that, that's a good thing. And thus the budgeted fund balance doesn't change during the year unless you have a resolution to change it. So I think that's maybe the one area that the way I reported this versus maybe the way you think about it is a little different. I don't know if that helps. I'm going to kind of rethink this again. I think maybe the simplest thing might be to not show you that fund balance, because again, it's generally not going to change from the budget perspective unless we do a resolution. I also would tie that into the second page of my report is the status of our contingencies this year. We've not used very much contingency funding yet this year. That's really our first line of defense, if you could say. If we have some accounts that are over budget, we draw on the contingency, and you take action for that. Then the next step, if we really need a lot more money, is the fund balance. And again, unusual that we have to take action to use more fund balance. I don't know if that helps. Try to simplify it a little bit, but we'll continue this as kind of a work in process as to how that information will help you on a monthly basis. If you've got any questions on that now, I'll do my best, or if you want to talk about it more outside of the meeting, that's great also. Okay.
Thank you, Eric.
Thanks. Yep. And thanks for a little time for some accounting 101, maybe 301.
Report of the Financial Rules Committee per Rule 7, please.
Thank you, Mr. Chairman. The Finance and Rules Committee reports that they have examined the claims presented for payment in the total amount of $2,744,745.80 and recommend that they be audited and allowed for the amounts claimed.
Someone like to move that, please? Andrea, second by Vince. Discussion. All in favor? Anyone opposed? Carries. Moving on to resolutions, we are withdrawing number 147, and we are pulling 131, 134, 154, 157, 158, 159 for individual votes. Are there any others that anyone would like to pull the vote on individually?
Yes, 133, 135, 148, 156, 140, 141, and 143.
Say that again, please.
Oh, sorry. 133, 135, 140, 141, 143, 148, and 156.
Are there any left?
A few.
Okay, would someone like to make a motion to move the consent resolution packet forward? Jess, do I have a second? Herb, discussion. All in favor? Anyone opposed? And the consent resolution packet carries. And we will go back to 131, I think.
Resolution number 131 is auditing and allowing claims in the amount of $2,744,745.80.
Moved by Andrea, second by Jeff. Discussion.
Mr. Chairperson, I have to abstain from this vote because there was a check payable to me and upon a voucher I approved.
Please reflect that in the notes. And this is a roll call.
Legislator Calamus,
Yes.
Legislator Lindecker,
Yes.
Legislator Morahan,
Yes.
Legislator Nellenbach,
Yes.
Legislator Frost,
Yes.
Legislator Mosier abstains, Legislator Nortz,
Yes.
Legislator Leviker,
Yes.
Legislator Osborne,
Yes.
and Legislator Dahlhoff.
Yes.
The next one is resolution number 133, and this is a resolution to transfer funds in the Buildings and Grounds Department.
Someone like to move it? Andrea, do I have a second? Herb, discussion. All in favor? Anyone opposed? Carries.
Resolution number 134 is the resolution directing the demolition and removal of an unsafe building pursuant to local law number 2-2007.
Someone like to move that, please? Jeff, second by Tom Osborne. Any discussion? All in favor? Anyone opposed? That carries.
The next one is resolution number 135. This is reappointing member to Development Authority of the North Country.
Moved by Jess, second, Tom Kalmus. Any discussion?
I was just wondering if we have term limits or anything. I mean, do we ever look for new people, or is nothing against Eric? It's just,
There are term limits, I believe, and we do.
Some boards do have term limits.
And we do advertise it when the time comes. Any other discussion? All in favor? Anyone opposed? Carries.
The next resolution is 140, and that is a resolution appointing ex officio member to Lewis County General Hospital Board of Managers.
Moved by Tom Kalmus, second by Jeff Nelmack. Discussion. All in favor? Anyone opposed? That carries.
Resolution number 141 is a resolution adopting the county legislative policy restricting electronic device use during executive or exempt privilege sessions.
Moved by Tom Kalmus, second by Herb. Discussion. All in favor? Anyone opposed? Carries.
The next resolution is resolution number 143, and this is resolution calling on Governor Kathy Hochul to veto Senate Bill S 8012 and Assembly Bill 8332 relating to the assessment of solar and wind energy systems.
Moved by Herb, second by Josh. Discussion. All in favor? Anyone opposed? That carries.
The next one is Resolution 148, and that is a resolution authorizing Lewis County to apply for 2025 New York State Empire State Development Strategic Planning and Feasibility Studies Grant Program funds to advance the preparation of a feasibility study focused on hosting a child care center at Beaver River Central School District.
Moved by Tom Kalmus, second by Josh. Discussion.
A few of the board members at Beaver River reached out to me. They were wondering if this could be reworded so that if they get the money, it can come back to them for a discussion about it.
Cass, do you have any comments on that?
Working with Todd Green.
Okay. They just would like some say in it.
Okay,
Absolutely.
Okay.
fair enough. Any other comments? All in favor? Anyone opposed? Carries.
The next one is going to be 154, and that is a resolution adopting and otherwise treating local law number 5-2025, County of Lewis.
Moved by Tom Osborne, second by Jess. Discussion. Whoops, yeah. This is roll call.
Legislator Mosher,
Yes.
Legislator Nortz,
Yes.
Legislator Leindecker,
Yes.
Legislator Frost,
Yes.
Legislator Leviker,
Yes.
Legislator Moorhan,
Yes.
Legislator Nellenbach,
Yes.
Legislator Osborne,
Yes.
Legislator Calamus,
Yes.
and Legislator Dahlhoff.
Yes.
The next resolution is 156, and this is reappointing members to Lewis County Youth Bureau Advisory Board.
Someone would like to move it, please? Jessica, second by Vince. Discussion.
Mr. Chairman, please show me abstaining due to a conflict.
Please note the record for that. Any other discussion? All in favor? Anyone opposed? Carries.
Resolution number 157 is a resolution accepting title to real property as alternative to owner's demolition enforcement order under local law number 2-2007, unsafe buildings law.
Someone like to move it? Tom Osborne, second by Jeff Nellenbach. Discussion. All in favor? Anyone opposed? Carries.
Resolution number 158 is a resolution appointing the Lewis County Code Enforcement Director.
Someone like to move it? Andrea, second by Herb. Discussion. All in favor? Anyone opposed? Carries. Congratulations, John.
The last resolution is 159, and this is a resolution authorizing Lewis County to apply for 2025 New York State DOS Brownfield Opportunity Areas Program funding to complete a countywide Brownfield Opportunity Areas inventory.
Moved by Herb, second by Jessica. Discussion. All in favor? Anyone opposed? Carries. Do we have any other business that anyone would like to present to the board? Sheriff, would you like to say a word?
Involves a member of the board. We're ready. I could do it now, but I know you wouldn't appreciate it. That's why I'm asking professionally to go to executive session.
Talk about a specific person.
Yes, ma'am.
Okay, would someone like to make a motion to go into executive? Tom Osborne, second by Jeff Nellenbach. Any discussion? We are going into executive session.